Hello, everyone. My name is Annette Akinshete, Dr. Annette Akinshete. I'm a consultant public health physician and the National Director and CEO of Sickle Cell Foundation Nigeria. Sickle Cell Foundation Nigeria is domiciled within the National Sickle Cell Center. This center is located just opposite Luth and is the first of its kind in the whole of Africa. We do everything relating to sickle cell, from sickle cell prevention, treatment, care, and support, and now even cure, because we have established a bone marrow transplant center in collaboration with the Lagos University Teaching Hospital, which is a cure for sickle cell. So if somebody was SS, that is having sickle cell anemia, the person becomes AA, is cured of sickle cell. So today I'm just kind of setting the stage. Let us know more about sickle cell in case persons are listening who do not know what sickle cell is or who are not so sure what sickle cell is about. So one thing to note is that sickle cell is an inherited condition. It is genetic. It's not something you can catch. It's not infectious. It's not contagious. Okay? It is something you get from your father and your mother. If your parents do not have that gene, you will not have it. Okay, having said that, there are also many myths and misinformation and disinformation that surround sickle cell that I would like to debunk at every opportunity. One is this, that sickle cell is a death sentence. No, sickle cell is not a death sentence. Sometimes you hear people ascribe age limits, that persons with sickle cell die by the age of 16, or they die by the age of 20, or they die by the age of 25. Again, that is not true. When persons with sickle cell are properly managed, properly treated, they can live long, productive lives and really contribute meaningfully to their communities. We have persons with sickle cell who live up to the 60s, 70s, 80s. True, in the past, it used to be seen as a pediatric disease, a disease that you find in children. But like I said, as time has gone on, treatment protocols have improved, and we have them living up to later decades of life. And in fact, these days, they don't call themselves sickle cell patients or sicklers. They call themselves warriors. So don't be surprised when you hear that they're sickle cell warriors. So in terms of, let's say, okay, what is sickle cell? We talked about inheritance, that is not contagious. But what is the problem really with sickle cell? The problem lies in the red blood cell. And if you remember your biology, you have red blood cells, you have white blood cells, and you have platelets. I'm not sure if you remember the platelets. That's number 3. Now, the white blood cells are the ones that help you fight infection. The red blood cells are the ones that help you carry oxygen around the body. And without oxygen, there's no life. That's why red blood cells are very important. The problem with sickle cell lies within the red blood cell. There is a substance in the red blood cell called hemoglobin. The hemoglobin in the person with sickle cell is designated S hemoglobin. The problem with that is that it changes the characteristic of the red blood cell such that it's not efficient or effective in carrying oxygen around the body. For one, the cell is shaped like a sickle. That's why it's called sickle cell. A sickle is a farming implement or a harvesting tool. Or if you like, it's shaped like a banana, or shaped like letter C, or shaped like a crescent moon. And the result is that these cells don't live long in the body. Whereas the normal red blood cell will live 120 days, 3 months, sickle cells die off within 10 to 20 days. So you see, the hallmark of the condition, therefore, will be anemia, shortage of blood. So they're always usually very weak. Okay? Another thing is pain. Pain is a hallmark of this condition. And that is why persons with sickle cell say they suffer sickle cell crisis. And they will tell you that the pain is so severe, it is worse than labor pain. And doctors want to relieve pain. And that is what the first thing we want to do to help somebody who has sickle cell crisis. There's so much to talk about sickle cell. We can't finish it in one episode. And I think perhaps next time we'll talk more about the basics of sickle cell disorder. Then we go into frequently asked questions about sickle cell. See you next time.